The question, is vestibular rehab effective for vertigo dizziness relief? What's the evidence base? Anecdotally, many patients report finding VR helpful. A brief review of recent literature supports a positive view. For instance, a 2014 Cochrane review concluded the following about VR for unilateral periperal vestibular dysfunction. There is moderate to strong evidence that vestibular rehabilitation is a safe, effective management for unilateral peripheral vestibular dysfunction, based on a number of high-quality randomized controlled trials. There is moderate evidence that vestibular rehabilitation resolves symptoms and improves functioning in the medium term. However, there is evidence that for the specific diagnostic group of BPPV, physical repositioning maneuvers are more effective in the short term than exercise-based vestibular rehabilitation, although a combination of the two is effective for longer-term functional recovery. There is insufficient evidence to discriminate between differing forms of vestibular rehabilitation. Source: vestibular rehabilitation to improve dizziness, balance and mobility in patients with unilateral peripheral vestibular dysfunction. The above relates to just one form of vestibular dysfunction. There are many other causes of dizziness and vertigo. If you are interested in a specific form of VR therapy, and/or a specific balance disorder or symptom, you would need to search the literature using those details. A few other recent papers that may be of relevance. Effectiveness of a vestibular rehabilitation protocol to improve the health-related quality of life and postural balance in patients with vertigo. The effectiveness of vestibular rehabilitation interventions in treating unilateral peripheral vestibular disorders. A systematic review. Understanding patient experiences of self-managing chronic dizziness. A qualitative study of booklet-based vestibular rehabilitation, with or without PubMed and CBI.